So first of all, I would say it's a great honor to have been elected to be a member of the Accademia dei Lincei, such a prestigious academy with so much history. And my talk is going to be a change of pace from chemistry to mathematics into biology. I hope people believe that this is an important field, actually. I've been studying for almost 40 years with a very important, I believe it's a very important topic, the growth to the regulation of blood vessel growth. This is, of course, one of the major biological themes. Without the blood vessels, very little to envision any growth, at least in multicellular organisms. Blood vessels are critical not only for growth and differentiation, but also for another very important aspect, which is communication between tissues, providing some instructive signals. And actually, this slide, illustrate is from a review. Oh, sorry. I think. Okay. This slide illustrates some aspect of blood vessel growth. Describe the vasculogenesis and angiogenesis. Vasculogenesis is mostly an embryonic phenomenon. There is a growth of blood vessels from inside, from a precursor like hemangioblasty, which you can differentiate in a primary capillary plexus and juvenile system, and then into a mature vascular system. In an adult, you have primarily angiogenesis, which is sprouting from a local veins, from a local veins, And when I started working in this field, which was in the mid-80s, people already identified numerous factors which regulate, blood vessel growth or angiogenic factor. This illustrated a dozen, but there were even more, And probably the most, prominent candidates were acidic and basic fibroblast, growth factor, which are very potent, extremely potent angiogenic factor. But there was a problem with this molecule. There never seems to be at the right time, at the right place when angiogenesis takes place. If you're blocking, for example, basic FGF, there was actually nothing happened. Even the knockout of acidic, the double knockout of acidic and basic FGF had hardly any effect on blood vessel growth. And the same can be said about all these other molecules. So something was really missing for this picture. And I was very fortunate to give a contribution to this field, actually. I was working, actually, at that time, I was a postdoctoral fellow at UCSF in the mid-80s. I was studying, actually, in a field which seems to be far from blood vessel growth, which was endocrinology. I stumbled in a population of the cells in the pituitary called follicular stellate cells, which are very different from the cells which produce hormones like growth hormone, ACTH, etc. These cells actually have an organization which looks like, like astrocytes or even macrophage. They were thought to be supporting cells, or stem cells, But there was an aspect which I thought was extremely intriguing to me at that time, which is indicated by this red lines. They tend, to end up, with the projection in the vascular space, in the blood vessel, which suggests even some early investigator that the cells perhaps play some role in regulating, the vasculature. And this was, I thought it was something that was very intriguing. To make a long story short, I was able to develop, culture of follicular stellate cells, and I tested the supernatant of these cells. And lo and behold, there was a very strong angiogenic effect, mitogenic effect, on isolating, capillary endothelial cells. And this was what started actually my scientific story. In 1988, I joined Genentech, which was, of course, a very important, biotech industry with the fantastic technology. And in a very relatively short time, we were able to give an identity to this mysterious factor produced by follicular stellate cells. And we call this molecule vascular endothelial growth factor. It's a secretin protein, it's a glycoprotein, which it's an homodimeric organization. And I will show you that this molecule turned out to be very, very important in biology, actually. The decades later, we have a much better idea of the VEGF pathway. There is a 3-tyrosine kinase receptor, actually, which regulates this pathway, which includes not only the original VEGF, which is called VEGF-A, which interact with the two receptors, VEGF receptor 1 and VEGF receptor 2. There is additional ligands, and there is a third receptor, which is called VEGF receptor 3, which, in contrast to VEGF receptor 1 and VEGF receptor 2, regulate also an extremely important aspect of angiogenesis, which is lymph angiogenesis. So we'll show that this pathway regulates some key aspect of the blood vessel growth. Not only blood vessels, but also lymphatic vessels, And the first receptor was a VEGF receptor 1, which is interestingly, this receptor is very poor signaling molecule, but binding of VEGF extremely tightly. And utilizes some structural domains of this receptor, resulting in very important therapeutics. I will make some example. But the key receptor is VEGF receptor 2, which mediates all this effect. Actually is similar to other tyrosine kinase receptor with some unusual feature. But it mediates a number of effects like a proliferation, migration, survival, and a very important vascular permeability, which is another very important characteristic of physiology. This is probably an experiment published 30 years ago. The one that probably more than any other experiment illustrated the importance of VEGF in biology. This is the conventional knockout of VEGF, and actually show that, something which is absolutely surprising. Inactivation of a single allele, one of the two alleles of VEGF, results in embryonic lethality. This is the wild type, at day 10.5, mid-gestation, there is a very nice vascular development. This is the mutant which lacks only one of the two alleles. Most of the time, you need to inactivate both alleles to have the phenotype. In this case, with the inactivation of a single allele, this embryo is dead, or severely underdeveloped. So this is a very, very unusual feature, and I will show you that predict, even some therapeutic aspect of a VEGF. But this, of course, does not mean that, even though VEGF-A seems to be so critical, does not mean that it's the only player in vascular development. These slides illustrate, some of the cellular player and molecular players involved, in the development of the vasculature. Mostly we have, tyrosine kinase receptor, as well as some serine threonine kinase receptor, like the TGF-beta receptor. It's like a symphony. It needs to be perfectly timed, which results, for example, not only in the growth of differentiation of the hemangioblasts, which is a precursor cells. FLK1 is actually the name of a mouse VEGF receptor 2, which illustrated this is a very critical system. And then tyrosine kinase, like ephrins, will result in differentiation in veins and arteries. And then, the sonic edge-jock, is also very important for additional differentiation. And then the PDGF receptor system, is very critical for recruiting, some cells in some perivascular cells like a pericyte. So this is an extremely complex, process which cannot really be disrupted. But one of the things that have always, intrigued, people about angiogenesis, the possibility there could be a way to treat, some serious pathological condition. Cancer was the first one to be actually talked about. This is a slide from Dr. Folkman, which probably was the first one to propose the idea that blocking angiogenesis could be a way to treat tumors, even though this concept of angiogenesis has been existing for a very long time. And the question is, what is the role of VEGF into that? So far, as I said, most of the attempt, to block, individual angiogenic factors, it had no effect. And that time, to our surprise, we made a monoclonal antibody with target, VEGF-A called A461. And this antibody, as a single engine, resulted in a strong inhibition of the tumor growth in this tumor cell lines. At that time, it was a very, very surprising data. And actually, of course, we did a lot of studies, but this led to the idea that blocking of VEGF could be a way to treat tumors. And we made a variant of this antibody, a so-called humanized antibody, which is a murine antibody could not be given to humans because it would be highly immunogenic. The humanized antibody instead will be maybe 93% human, and only the regions which bind antigen will be mouse. And this antibody has been in clinical trial was started clinical trial in the late 90s. They call it bevacizumab or Avastin. And this antibody, actually, the first study that proved the concept that blocking angiogenic can have a benefit was published actually over 20 years ago in patients with previously untreated metastatic colorectal cancer. And there was a survival benefit in patients treated with the bevacizumab, in comparison plus chemotherapy versus the control, which is chemotherapy plus a placebo. And since then, this drug has been approved, not only in first line, in second line, in colorectal cancer, in cervical cancer, in lung, cancer, in renal cell cancer. But, mostly in combination with the chemotherapy. Over the last, several years, there's been really revolution with the immunotherapy, which resulted in so many benefits, And there is evidence that, blocking of VEGF can have some additive or synergistic effect with immunotherapy. It's been shown that if you block, VEGF, there is increase, in the tumor infiltrate, lymphocytes, and VEGF itself can have some effect, some immunomodulatory effect, And today, actually, the combination of bevacizumab and other anti-VEGF agent with immunotherapy, it becomes a standard of care in some very difficult to treat, malignancies. For example, this is hepatocellular carcinoma, liver cancer. And there are attempts to combine in combination with other malignancies. And today, actually, making a bispecific antibody, an antibody can block, both VEGF-A and PD-1 or PD-L1 is very popular. There is multiple agents may block it. So this has become a new frontier of cancer therapy, the combination of anti-angiogenesis with immunotherapy. And actually, VEGF turned out to be a very valuable molecule. But there is another clinical area where anti-VEGF has had perhaps even greater clinical impact, which is in blinding, the neovascular disorders. And one of those is age-related macular degeneration. But it's not the only one. There are others like the diabetic retinopathy. But this is probably the most, the best understood, which is a condition which has been in a different stage of being identified: early AMD, intermediate AMD, and then advanced AMD, which is the one which result is the most severe visual loss. And actually, the one with this asterisk is the advanced neovascular AMD, even though it accounts for about 20% of the case of AMD, resulting in about 80% of cases of severe visual loss. You can easily appreciate why. There is this growth of blood vessels, which actually bleed, leak, and destroy, can destroy the retina in the photoreceptor. It is for a long time, there was practically an intractable condition, And actually, the anti-VEGF has had a lot, for that. This is one of the earliest, studies, actually, utilizing an antibody fragment which is derived from bevacizumab, this was called ranibizumab lucentis. It is actually visual acuity in patients with an advanced form, a severe form of macular degeneration. This green line is not a control. This was at that time the standard of therapy called photodynamic therapy. There is a little bit of increase in visual acuity, and then there is this severe visual loss, which is indistinguishable from no treatment. Instead, in these two dose groups of ranibizumab, which in the study were injected on a monthly basis, there is this increase in visual acuity, a very significant increase in visual acuity. And about 70% of patients have a benefit, maybe 25 to 30% have a more limited or no benefit because of fibrosis, etc. But this has been clearly one of the most striking benefits of anti-angiogenic therapy. And actually, this has some concept of vascular biology, which probably explain this benefit. Blocking of VEGF in this case not only dramatically slow down the growth of these blood vessels, these tortuous and abnormal blood vessels, which are called the choroidal neovascular syndrome. But also, there is actually the vessels which are most severely abnormal, can regress, can be pruned. So you can have a somewhat of a more normal vascularization. And today, actually, there is a series of drugs which has been approved, anti-VEGF agent, which have been widely used. One is Avastin, bevacizumab, which even in Italy has been a controversial drug because even though it was approved for cancer, but was widely used, to treat actually neovascular disorders with a very low cost, making aliquots, from the cancer vials. Also, ranibizumab, there is another drug called Eylea, which is a soluble receptor, which is based on VEGF receptor 1 and 2. And there is also another drug which is a single chain fragment, and this is a bispecific antibody which binds VEGF-A and angiopoietin. This drug has been this class of the drug has been the standard of care in this disease for the last 20 years or so, and maybe millions millions of patients have been treated with this drug with a very significant benefit, actually. So far, actually, it may sound very disappointing, but, targeting additional molecule involving in vascular development didn't add any benefit, very little or no benefit. So as of today, probably the future of this therapy seems to be in optimizing the dose, because, for example, this drug is given at 6 milligrams. The initial dose of Avastin was 1.2 milligrams. So the dose has been a very critical development, as well as, for example, in gene therapy with the AAV, which result in also permanent, expression of some of this, for example, aflibercept, ranibizumab. But the risk, of course, that, this permanent expression potentially is some risk, And there are other molecules which have inherently longer life in the retina. This is an area that my lab has been implicated. Actually, we have a new molecule in clinical trial. I don't plan to talk about this, but the idea that, if you have a molecule, it can be retained in the retina, that could result, in an advantage. And so far, we have the data actually show that, since the introduction of anti-VEGF agent, there has been, this is a study conducted in Denmark, which is a relatively small country with a very good health, system, And this is the plot, the incidence rate of legal blindness, due to AMD or other causes. And you can see since 2006, when the anti-VEGF agent were introduced, there has been about 50% reduction in the incidence rate of legal blindness. This is this is a plot not only neovascular AMD, more cases of AMD. So perhaps the benefit could be even greater. And but there is actually, and it's kind of interesting now. This is the same slide I was showing you previously. Now that the anti-VEGF agent has become a very effective treatment for neovascular AMD, this is no longer the leading cause of severe visual loss in AMD. Instead, it had a form called geographic atrophy, which is these areas of the retina which become atrophic, which obviously are not going to be treated with anti-VEGF. It's been really a challenge, to find the therapy for this condition. It's been a very complex, And there is a number of genetic studies, genome-wide association, which have identified a number of, gene variants which have been associated with AMD, especially with the geographic atrophy. Probably one of which is the most, strongly associated is complement factor H, which is an inhibitor of a complement, essentially in a molecule which essentially dampen, regulate, the effect of a complement, which can be destructive effect, And so there has been lots of interest in targeting, the complement, pathway, naturally, and actually, so far, 2 drugs have been approved, which target the complement C3 and C5 complement. But the benefit has been very limited, I must say. There is no increase in visual acuity, and there is maybe a modest slowdown in visual loss. So something is missing here. So I don't know how much time I have, but I would like to make a point, actually work with done in our lab. We've been very interested. The idea that the vasculature, even the opposite way to neovascular AMD, can be very important. There is data that show that in geographic atrophy there is a substantial, even dramatic loss of choriocapillaris. There is a regression or dropout of endothelial cells. This is in the geographic atrophy as compared to control or AMD without geographic atrophy. And so this is actually illustrating the organization of the retina in its vasculature. This is the choriocapillaris, which is this, which supply about 70% of the blood flow in the retina. And so there is a number of really. So the idea is now that with the anti-VEGF agent, which provide an effective treatment for neovascular AMD, is the geographic atrophy has become the leading cause of blindness. So can we do something to reduce, this choriocapillaris dropout? And so this has been clearly the challenge, actually. In theory, you could think that, giving a molecule like, VEGF, which is the the principal regulator of blood vessel growth could be a treatment. In normal development, VEGF is very critical for the development of this blood, but there is an absolute requirement for VEGF. But using VEGF as a therapy is very difficult because this molecule is a very, very tight, dose response. It can induce leakage, bleeding. So clearly, we need to do something else, And then what came in our help is in a concept which is now very well established, and heterogeneity in the blood vessels. There is not a size that fit all. You can see the blood vessels in the liver, in the kidney, in the heart. They're all very different. So maybe can we do anything? Based on this diversity, could help solve our problem. I will say that our lab actually over 20 years ago identify an angiogenic factor selective for certain endothelial cells. In this case, they were endothelial cells in endocrine gland. And a molecule called EGVGF or prokinetis 1, which is a small protein. And we're able to show that this molecule actually is expressed actually in the testis, in the ovary, in the adrenal, exactly where you expect a molecule like with this characteristic. So the question is, can we identify mitogen selected not only for this particular endothelial cells, but other endothelial cell type? In other words, can we identify a factor specific for the choriocapillaris? And this was really the challenge that we used. And we were able to actually using a proliferation assay. This is an assay basically biochemical and biological. It utilizes choroidal endothelial cells as a bioassay. We're able to identify the tumor cell line which does not produce VEGF or any of the known angiogenic factor, but still is stimulating the growth of choroidal endothelial cells. And actually, we are able to isolate this factor, to identify this factor, which very surprising turned out to be identical to leukemia inhibitory factor, which is a molecule which is very well known to those who study stem cell biology. But paradoxically, have been identified as a growth inhibitor for endothelial cells. But as you can see, recombinant LIF, stimulating the growth of choroidal endothelial cells. Not quite like VEGF, but not far off. And there is even an additivity with the VEGF. And so we thought, is it possible that this molecule could be valuable therapeutic? Let me just very briefly remind you that LIF is a member of the IL-6 family, which is, of course, an extremely important family of regulators. Actually, there is a 12 molecule. IL-6 is the prototype member. They have a specific receptor and a common subunit for this class, which is called GP130. Interaction with the ligand promoting heterodimerization, which initiates a signal transduction cascade, which in case of LIF, involving JAK-STAT, STAT3 is the mediator. And so we wonder whether a LIF could be potentially a useful agent. Actually, intravitreal injection of LIF in mice stimulate angiogenesis, which is really very, very, very consistent, very robust, actually very rapidly. And actually, even in a model of a geographic atrophy is a disease unique to humans. But there are some models, like sodium iodate, which is strongly oxidating agent, actually, which result in this kind of in this dramatic flattening of the retina, and there is a loss of photoreceptors, And this is no treatment of this PBS with the sodium iodate, and this is LIF, with sodium iodate. There is almost a normalization in the architecture of the retina, and this led, to the idea that this could be perhaps relevant to human disease. So now we have this very nice single cell transcriptomics, which so much help making possible things that otherwise would take years. And this is from this expression of the member of the IL-6 family in a very, very, very nice data set from the choroid developed by a group at the University of Iowa by Robert Mullins. And you can see this is this common subunit which is actually expressed in all cells, endothelial cells, etc., etc. Instead, the LIF receptor, LIFR, is expressed very strongly in endothelial cells. This is almost exactly what we're hoping to see. Almost to the same level as KDR, which is a name, for VEGF receptor 2. So this molecule very clearly is very strongly, potentially very strongly implicated even in angiogenesis. It could be used to protect, the choriocapillaris. And instead, this is the IL-6 receptor, which is once again, with prototype members. There is expression a little bit in endothelial cells, but there is a very strong expression in inflammatory cells, which you don't find, for LIF. So this bode well, for finding a therapy. So this is what really we hope to achieve. Actually, we try to develop, a LIF, mimetic, which is longer acting, which hopefully will start clinical trial in the near future. And this is be the idea that this is the healthy macula with the well-developed choriocapillaris. And then when you have a geographic atrophy, you have this dropout of endothelial cells, of the blood vessels. And perhaps a LIF or a LIF similar could prevent this effect. If this could turn out to be true, it would be absolutely fantastic to be able to give a therapy not only for the neovascular AMD, but also for the atrophic form. But still, time will tell whether this is really whether this can happen. And finally, I want to acknowledge many people. Of course, this work has been going on for a very long time, actually for decades. The work at Genentech. But it's some of the recent, collaborators which have given actually have an Italian actually ophthalmologist in my lab. Dr. Tommaso Mori has done great help in this. And with this, I would like to thank you very much for your attention.
Thank you so much. Any question?
Quick question. There are people, there are considering anti-leaf therapies for in the tumor microenvironment.
Yeah, absolutely, yeah.
Do you foresee eye problems by targeting leaf?
Leaf is one of the molecules which is a really... Actually, we identified LIF at the very beginning, in the early 90s, actually. A molecule which inhibits aortic endothelial cells that have no effect on capillary endothelial cells. It's a very complex effect. I know what you are referring to, that immunotherapy, combining immunotherapy, etc. I don't believe that this is much of a relevance with what we are seeing here.